All right, I'm so excited for this week's episode. I have a special guest here, and we're talking about when you feel responsible for everyone's feelings, which is kind of a bigger discussion with codependency. And I have Dr. Amanda Harms here to talk about that. So, welcome to the episode, Dr. Harms. I'm excited to have you. Tell us a little bit about yourself, what you do, your practice, all the things.
Okay, thank you, Nikki. Thanks for me on the podcast. I appreciate it. So I have been in the counseling business for just over 10 years that I've been doing this. Worked hard on getting my PhD in social psychology. And my current practice right now is pretty slow. I started my own practice after I graduated with my PhD. It's called Loving Life Counseling in Colorado. I think there's other places called Loving Life Counseling, but it's a very small practice. I've been doing other things like writing a lot of digital material, writing books, things like that. So that's more of my genre. And personally wise, so I've been married almost 30 years. Coming up next year will be 30 years.
Awesome.
And we have 6 kids, and I have a grandbaby on the way. So,
Oh, that's so
yeah,
fun.
I'm really
That's awesome.
excited about that.
Very cool.
Although my daughter has been living with us for a little bit, so and she's been having morning sickness, and I'm like, oh,
Oh, darn it.
yeah. So that's been fun, but
Oh,
um, but hopefully soon she'll reunite with her hubby. He's in the military, and so
oh,
it makes it difficult.
awesome.
But
Yes.
other than that, that's a little bit about
Awesome.
me.
Very cool. Do you have certain specialties that you like to see in your practice?
Absolutely, I do a lot of trauma informed care. I do EMDR. That's the major one that I really like to
Okay.
do. But
Yeah.
the usual anxiety, depression,
Yeah.
things like that. So,
Awesome.
yeah.
Awesome. Yeah, I was excited when I was looking at your website and you were talking about codependency because I think this is something that people hear the term, but they don't really know what it's about. And so that's why I titled the episode something different because I think people don't really identify with, like, I have codependency. That's not something that people recognize. But when you start talking about it, understanding it, they're like, oh, yeah, I do feel responsible for everyone else's feelings. Right. So, and mostly the audience listening to this is women and members of the Church of Jesus Christ of Latter-day Saints. So when women are saying I feel responsible for other people's feelings, what is usually happening internally for them?
So, I think a lot of women or whoever's has codependency feel that maybe they assume that it's their fault in the fact that if somebody's having an emotional struggle, they think, oh, it's my fault, or they feel a lot of guilt. They feel danger in a lot of ways, a lot of anxiety, definitely. They
Mhm.
don't feel safe. And they confuse empathy with responsibility.
Mm,
They feel like it's their job to fix things. So
mm.
I mean, there's a lot going on, I think, when it
Yeah.
comes to their emotions and what they're feeling.
Yeah.
Yeah.
So what would that look like or sound like for a woman who is um, you know, just a typical day and someone else is having this emotional reaction to something and they're kind of over empathizing with this. What would that look like internally for them, or what do you think they're kind of saying to themselves?
Oh, so I would think that they would be like, just, I think it starts off with anxiety a lot of the
Mm,
times. And
yeah.
so they would be like, okay, I need to take care of this. I need to be able to make them better because when they're okay, I'm okay.
Mm,
And so they just tend to, um, I, well, I heard a term called F brain. I don't know if that's been going around more so, but the F brain, right? The fight,
mhm,
flight, freeze, fawn. And I think
mhm,
codependents do a lot more of fawning. So they want to
mhm.
just make the person feel better, fixing. They want to fix
Yeah.
the situation. And so they're that's what they would probably be doing. They'd be trying to, okay, how can I make this person feel better so that I can feel better?
Mm,
And it's coming more from a place of anxiety, obligation, fear, and all those things. So
yeah.
I don't know if that
I
answered your
love
question, but
Yeah, yeah. So they're feeling responsible for somebody else's emotions and feeling like it's their job to fix that person's emotions or fix something about themselves so that they can fix that person's emotions, really.
exactly.
Okay.
Exactly.
Awesome.
Yeah.
So what does it slowly do to someone emotionally when they keep doing those things? If they just kind of stay in that emotion of fixing everybody else or feeling responsible when somebody else's emotions are going, what's going to happen for them if they keep carrying that?
Oh, yeah, definitely. Well, they're definitely going to have emotional burden, baggage,
Yeah.
a lot. It's going to be heavy. It's a heavy burden to constantly having to be able to take on other people's emotions and feelings.
Yeah.
They they definitely wouldn't be able to. I think what happens is that they're so focused on the other person that when it comes back to them, they can't distinguish between their own emotions. It's almost
Mm.
like they know it's kind of what Brene Brown said. I don't know if you love Brene Brown. She's
Yeah.
I
Yeah.
love Brene Brown, but
Yeah.
Brene Brown says that most people, well, mostly men, but some women, they only can distinguish between three emotions, right? Happy, sad, and angry. And I
Yeah.
think for codependents, that's what they know. I'm just, oh, I feel good or I don't feel good.
Yeah.
And so they don't know how to distinguish between those emotions. They get burnt out,
Mm.
definitely, right? They get irritable, a lot of resentment they start to
Yeah.
feel. Maybe even towards getting to the point where they just are apathetic, because that's what happens when we get burnt out. We just become apathetic. And
Yeah.
then the guilt comes in for feeling apathetic.
Yes.
And so then it's like, oh, they just can't win. They can't win.
Yes. Yeah. Yeah. So it doesn't
No.
matter what's happening, it's kind of hitting them in different ways. And so they feel responsible for fixing all things with that.
Yes.
And that can lead to burnout and overwhelm and probably distress on your relationships because you're constantly trying to fix other people in order for you to feel good. That the
Yeah.
whole environment around you needs to be okay in order for you to be okay. And I really like that like how you distinguish between, if you're taking on somebody else's emotions, you start taking on sort of their identity, right? And you stop being able to distinguish between your own emotions and somebody else's. Is this how I'm really feeling, or am I just taking this on from somebody else? Which can be very difficult to know and make decisions for yourself or know how you feel if you keep taking that on.
Yeah. Definitely. Definitely.
What's the difference between codependency and healthy emotional support? Because we can recognize, somebody might be going through something, and it's not like that we don't want to go up to them and be like, your emotions are yours, mine are mine, deal with your own, right? Like that's not really what we're talking about, right? So what's the
Yeah.
difference between having compassion and care for somebody versus codependency?
Oh, that's a really good question because a lot of people who have codependent codependency tendencies, that's difficult for them to figure out because one is boundaries, right?
Mm.
Codependence, people who have codependency tendencies, I don't like to call that,
Yeah.
to
Yeah.
label people. People who have those tendencies tend to not be able to define boundaries. They may go overboard with how they handle emotions or situations. And so boundaries is a huge one.
Mm.
Healthy people, of course, they know how to set boundaries with people. They know how to
Yeah.
when to say no, which codependents don't.
Yeah.
And I think like we talked about, codependents are this thing of, okay, if I'm okay, you're okay,
Mm.
type of thing. And like we said, it's out of fear, it's out of anxiety, it's out of obligation to have to take care of this. But healthy people, they care about you and they're just there with you to support you rather And it comes from a place of compassion.
Yeah.
Whereas codependents can't do that. They have to be there for you. And, oh, I got to take care of this,
Hmm.
which is hard. It's definitely hard. So,
I often see it too that they show up and want other people to not feel negative emotions. That's bringing that fear, that anxiety. So they
mm,
often are trying to move you out of your negative emotions quickly so that they don't feel that too, right?
yes.
And I think that's kind of what you're alluding to on those healthy boundaries of being able to say it's okay to be there with somebody when they're feeling emotions, but it's not your job to move them through it or out of it in your timeline, that you allow them that space and agency to make that choice.
Yeah, exactly. Exactly. I think some of the other things are like responsibility. I think we just talked about that. And, how they feel responsible for other people's emotions, whereas healthy people are more like, no, you're responsible for your own emotions, but I will support you through it type of thing.
Yeah.
Also, identity. And you talked about that a little bit, or we did. Identity, where the person, their self-worth is tied to feeling needed. And healthy people, they just stay themselves. They're like, I know where my self-worth comes, and it doesn't come from making you feel better.
Hmm.
So I think that's a big one. Oh, and just thinking about it, the emotional cost, right? How codependent people or people with codependency tendencies, they feel drained, they feel anxious, they feel resentful, they feel overextended, and they have all these feelings where healthy people usually feel connected. They feel compassion, they feel, I don't know, all those, those healthy things, and codependents don't. So,
Yeah.
yeah, that's a rough
Yeah.
one. Yeah.
Yeah. Yeah. They're taking on that from other people and not able to separate that. Yeah.
Exactly.
So if a woman is listening to this and they're feeling like, "Oh gosh, that might be me. I might, take on other people's emotions and feel like it's my job to fix them, or I get really uncomfortable when somebody else is feeling a negative emotion and feel it like it's my job to hurry up and fix them and make them not feel these emotions." What's one small shift that they could do and practice maybe this week, that if they're noticing this pattern in themselves? And we should also say there's a spectrum of this, right? That it's not like you are or you aren't. Probably everybody has some form of
Oh, yeah.
codependency in some areas of their lives. And you might
Yeah.
think, "Ooh, do I kind of do that?" And you might feel that. So maybe there's something small and simple that they could do to make a shift in this. What do you suggest they start doing?
Well, like I tell a lot of my clients, I say, let's flip the switch. Let's stop. Let's turn inward. And I think the biggest thing is to just really be mindful of our internal what's going on. So even if a person who has these tendencies starts to feel, just feel bad, feel frustrated, feel anxious, or feel whatever they're feeling, to just kind of stop and just go inward and ask themselves like, what am I feeling right now? What is going on? Why is this happening? I think that's a good start, but also ask themselves, is this my burden to carry? Is this someone, these person's emotions are real and they're really, really big and
Yeah.
I want to make it better. And I have so much anxiety here. I don't know what to do. I don't know how to.
Yeah.
It's just good to kind of recognize that you have that and to think, is this my burden to carry? If you could just at least start with that, it doesn't mean
That's
that you're going to
huge. Yeah.
stop being, but just recognize. And recognizing is
Hmm.
huge. Yeah.
Yeah.
Because that
Yeah.
helps you to start changing this up here.
Right,
So,
exactly. Well, it's that awareness piece. Like, if we're not aware that the reason I'm feeling anxious is because this person's having a big emotion and I want to fix it. So I like that first step too of like, why am I feeling what I'm feeling? Right? It's just this person's emotions make me feel uncomfortable and I'm not sure how I can fix them. And if you're having any thought pattern in that way, right? Of like, oh, it's my job to fix this in this moment, that awareness is really key. And I love that question to ask yourself, is this my burden to carry? And speaking in spiritual terms, we often with codependency, we kind of turn into their savior, right? We can
Yeah.
keep them from relying upon the true savior because we want to come in and be the savior for them. And that's not our role and that's not our job to
Right.
do that. Of course we want to care and help people and serve people, but there's a line, right? Like we
Hmm.
can feel prompted by the spirit to do something for somebody. But the motivation behind that isn't to fix them because they're broken, right? Or to fix them because they're having this emotion. It's just a prompting to do that. I can disconnect and walk away. And I don't have this rapid fire thoughts of like, oh no, what if that doesn't work? What if it doesn't do this?
Yeah.
There's a difference there in that. And we're not showing up as their savior. We're allowing them to rely on the true savior with their emotions and being the savior's hands in helping.
Yes, I love that. I really do. I I think part of that too is, and we were going to talk about that, but maybe I'm getting a little ahead of myself. But the new book that I did write is called Send It Love, and it's all kind
Okay.
of about this compassion, and because a lot of times, and if we take a step back and we go way back to when we were young, if if you had a caregiver that was not who was very unpredictable in some way, or if you were a peacemaker and you just had to make everyone happy and feel good, or something like that, right? As a
Yeah.
kid,
Yeah.
you had to learn certain or develop certain belief systems and learn certain ways of doing things to make everything good. And because of that, you grow up and you take that with you because it served you as a kid. It helped you to survive as a kid, right?
Yeah. Yeah.
And now
Yeah.
and now you're growing up and you're using all the same techniques and methods that you used as a kid. But guess what?
True.
Oh, it doesn't work anymore. It's not working for
Yeah.
you. And it's causing
Yeah.
a lot of grief for you and a lot of problems. So it's almost like you've taken this in, it's almost like that inner child that's wanting to come out to fix everything.
Yeah.
And it just doesn't work anymore because
Yeah.
you're adult.
Yeah.
And so the thing is, as we try and strive to change these belief systems, it can be really, really difficult, because it takes a good 3 to 6 months to change those neural pathways in your brain,
Yeah.
to change things. And if you do start changing it, a lot of people feel it feels weird to them because it's they're comfortable in the uncomfortable, and so they
Hmm.
continue. Okay, no, I know how to do this because I've been doing this since I was a kid. This is what I
Yeah.
know. And now if you're starting to change it by just being mindful and recognizing things and working on trying to change your behaviors, it's difficult but
Hmm.
doable.
Yeah. Yes.
Yes,
Yes.
it
Yeah.
is doable. I know, I've done it.
Yeah.
So
Well, I think you bring up a good point is that these habits were probably developed in a time when you needed them for safety, that you were young and you didn't know how to do anything differently. You weren't being taught,
mhm,
you weren't being shown how to do this. And so it makes sense that you develop these, but these strategies for dealing with big emotions and how people are reacting. And you also want to recognize this may not be healthy and helpful for your current relationships or a long-term strategy. And I often describe it to my patients as, for your whole life, you learned how to drive a car on two wheels. Your car is popped up on two wheels and it's very comfortable for you, right? Even though that's not the norm of what everybody else is doing. And so when you start to learn to drive your car on four wheels, it feels uncomfortable, even though it's probably the more safer, healthier way to live,
yeah,
right? And
yeah,
so sometimes we create situations or sabotage situations so that we can get back up in that comfortable state of living on two wheels, right?
mm,
But we need to
yes,
recognize that it's okay to be uncomfortable, setting those boundaries and saying this isn't my burden to bear for them. I can do this one thing for them and then set this boundary and be able to
mhm,
move forward. But learning a lot of strategies for internal nervous system regulation when you do that, because you're going to have to rewire your brain to not say this is unsafe to do this. It's unsafe to leave this person this way, or this is going to damage our relationship if I don't fix it for them. A lot of your brain and your body is going to distort the reality of that situation and cause you to come back to those codependent tendencies and not have that healthy relationship you're seeking out.
Exactly. Exactly. I love that analogy of the car. I've never heard it like that, but yeah, that's great.
Yeah.
That is good.
Yeah.
Yeah, no, and I like what you said about that nervous system regulation, because I think that's what's for people with these tendencies. A lot of times that they don't have their emotions regulated. They just are
Yeah.
like, I have to stuff them down, right?
Yeah.
Stuff them down or mask them over with helping people or making sure everyone else is okay. And
Yeah.
they don't really learn how to feel their emotions. And that's in my book, Send It Love. That's what we learn. We learn how to regulate emotions. We learn how to process our emotions so that they're not stuck in the body. How do we get
Yeah.
them out so we can make room for more emotions? Because emotions like to come and they like to leave. They don't like to stay.
Yes. And that's the
Yeah.
healthy way to deal with it, not make them stay, or you have to pass through them,
Yeah.
not go around them.
Yeah. And that's the problem is so many people are dissociating, right? They're they have addictions. They do other things to not have to feel, especially with people with codependency tendencies. Their way is to just make everyone feel better. So they don't have to
Right.
feel that pain. But we need to work on feeling those emotions and to work through them. I call them, so a lot of times when we would go throughout the day, and for people with codependency tendencies, we go throughout the day and we'll have little bouts of anxiety, or we'll try to avoid certain places or situations or things. And I like to call those residual trauma responses because it's not quite PTSD, you know.
Right.
PTSD is a lot more, night terrors and flashbacks and that's PTSD. But we have these, I call them RTRs, residual trauma responses, and those are the things that we need to kind of be aware of. I think for people with these tendencies, they need to go, oh, because that's really what's happening. They had to
Yeah.
develop these belief systems to survive as a kid, and now they're having these RTRs as adults. And
Yeah.
so my book actually teaches people, how do we deal with these RTRs and how do we process them and overcome them and things like that.
Yeah.
So
That's awesome. That's
yeah.
awesome. So if someone's listening to this and is feeling like this is me and I'm completely exhausted from being this way, right? And having this need to be responsible for everybody else's emotions. What's one thing you hope they heard today, or walk away with today?
Oh, I would definitely say you were never meant to hold this burden this much. You were never meant to do that. It was, like I said, it was it wasn't your fault. It was
Yeah.
a survival strategy that you
I
needed
love
as a
that.
kid, but now you don't need that anymore. And it's not your burden to carry anymore. It's time to let go.
Yeah.
So
Oh, I love that.
definitely,
I love that. Yeah.
yeah.
Then we're not going to shame our way out of this, right? You don't need to shame yourself
Oh,
for
yeah,
feeling this way, and it's okay
exactly.
that you developed that, and now you can let
Yeah.
it go and be able to develop different strategies.
Exactly. Hey, real quick, um,
Yeah.
what about the different personality types? Because when I think of codependency behaviors, I think of also personality disorders, I guess, that people have. There's a few different personality types. I know that I've worked a lot with like people with borderline personality disorder.
Mm-hmm.
There's also dependent personality disorder, and
Yeah.
not many people know this one, but there's also egoism. So, which is the opposite of narcissism. And they're not so much we'll talk about that in a minute, but I kind of wanted to talk about borderline personality disorder. And my mother-in-law had, I say had, she's passed away, she's moved on,
Mhm.
but
Yeah.
she had borderline personality disorder. And for her, it was difficult. I don't think she ever knew, but a lot of people who have codependency tendencies may have had a lot of trauma when they were kids in some way.
Yeah.
I know my mother-in-law, her father was narcissistic, he abused her, things like that.
Oh,
And so people with borderlines, of course, they have very intense emotions, right?
yeah.
They have a fear of abandonment, a fragile sense of self, of course. They have a very low self-esteem. They can be impulsive. They can have chronic feelings of emptiness, things like that.
Yeah. Yeah.
But one of the biggest things is they have unstable relationships, but they're they're codependent. A lot of
Yeah.
borderlines are codependent, and so
Okay.
they grasp all the time. I got to keep this relationship, but they don't know how to set boundaries. They don't know how to
Right.
do the healthy communication or things like that, and so it
Yeah.
makes it difficult. I didn't know if you had any insights on borderline personality disorder as well.
Yeah, I think it's a big chunk to kind of jump into
Yeah.
and talk about. I mean, I think um, you know, eh, people. I always describe it as when you're experiencing somebody who has borderline personality disorder, it sort of feels like you're in a tornado, right? Like you're kind of whiplash back and forth between things, and it does make sense that codependency is a part of that, and it does come with personality disorders. So something to be aware of and something to kind of think about, if that is something that you're experiencing to an extreme degree in your life. Maybe might
Yeah.
be good to seek out some help and see if that might be a part of your story and your journey as well.
It's true. It's true.
Yeah.
And additionally, there's a dependent personality disorder, uh, which is borderlines have all the same stuff. So it's basically everything, difficulty making decisions, the same things of unstable relationships, wanting to avoid conflict, but the fear of abandonment, and all those things. It has that as well. So
Yeah.
you may not be borderline and have a lot of the other things, but you're still codependent in that way.
Yeah. Yeah.
And then last, egoism. Now,
Hmm.
I only researched egoism because one day I was thinking about my husband and I thought, he's the exact opposite of a narcissist. I wonder if there's a term for that. And
Hmm.
found egoism. And I'm like, oh, yeah, he's kind of like that. And it doesn't mean
Hmm.
it's necessarily a good thing, but egoists can also be chronic people pleasing people. They can be codependent in so many ways. They have a difficulty expressing their needs. They have a fear of upsetting others. They have low self-worth. They
Yeah.
have an over attunement to others' emotions. So they're
Yeah.
constantly, oh, okay. They avoid praise. They avoid attention. They don't want to be noticed. And so to keep that in mind too. I mean, there's a lot of
Yeah.
people who have this sense of a fear of upsetting others, and so they have to
Yeah.
be very small, very
Yeah.
small. And
Yeah.
but you can still be codependent in many ways as well. So those were just some of the thoughts that had come to me about codependency, about personality disorders, because
Yeah.
something to just keep in mind and be aware of.
Yeah,
Yeah.
it can be a part of lots of different things, codependency for sure. And
Hmm.
so it's important to think about that. So I would love for you to kind of share where people can find you if they're resonating with this. Where can they, what are the name of your book again? Where can they find it? Tell the people
Yes.
all the things.
Yes, so my book just came out. I'm really excited about it. It's you can go onto you can get it on Amazon. I'm working on the audiobook. So if you're an audiobook person like me,
Yeah.
I am working on that and getting that out. But you can go to my website, Love and Life by Amanda at loveandlifebyamanda.org, or you can go to Amazon and get that book. I also have another book out, Breaking Free from the Shame of Addiction. You can get that one on Amazon as well, and
Okay.
or at Cedar Fort they have that. But that one's all about addiction, of course, and we all
Okay.
have some sort of addiction.
Yeah. Yeah.
Yeah,
Awesome.
definitely.
Great. Awesome. Thank you so much for
Yeah,
coming on, Amanda. I really appreciate this. If you guys
yeah.
resonated with this episode and you feel like it's something that someone else might need to hear, please share it with somebody else. And always remember, you're doing better than you think. Even if your brain's telling you that you're not, you're doing better than you think. But
Yes.
thank you, Dr. Harms, for coming on. I appreciate it. And
Yeah.
I will see you guys next week.